Hello, I'm Garvin. This telehealth video is on OxyNorm. So OxyNorm is used to relieve severe pain, for example, following surgery or a severe injury or associated with cancer. It may also be used for other types of long-term or chronic pain when weaker painkillers no longer work. So what is OxyNorm used for? Well, first of all, OxyNorm is a brand name for an opioid analgesic containing the active ingredient Oxycodone. OxyNorm is a legal narcotic that is available by prescription to treat severe pain. How does OxyNorm work? Oxycodone hydrochloride is a type of a strong painkiller known as an opioid, and opioids work by mimicking the action of natural pain-reducing compounds called endorphins, which are produced in the brain and spinal cord. Oxycodone acts on the same opioid receptors as our natural endorphins. It stops pain signals being sent by the nerves to the brain. This means that even though the cause of the pain may remain, less pain is actually felt. So OxyNorm is similar to morphine in effectiveness and side effects. So things you should know before taking OxyNorm. OxyNorm is a controlled drug, and there are several rules that your doctor has to follow when writing a prescription for it. If your doctor hasn't done this correctly, your pharmacist won't be allowed to dispense it. So OxyNorm capsules should be taken at 4 to 6 hour intervals. The dosage is dependent on the severity of pain and the patient's previous history of analgesic requirements. Increasing severity of pain will require an increased dosage of OxyNorm capsules. The correct dosage for any individual patient is that which controls the pain and is well tolerated throughout the dosing period. Patients should be titrated to pain relief unless unmanageable adverse drug reactions prevent this. The usual starting dose of opioid naive patients or patients presenting with severe pain uncontrolled by weaker opioids is 5 milligrams every 4 to 6 hours. The dose should then be carefully titrated as frequently as once a day if necessary to achieve pain relief. The majority of patients will not require a daily dose greater than 400 milligram. However, a few patients may require higher doses. So is an OxyNorm addictive? Yes, opioids are addictive when used recreationally. But in reality, if you're taking oxycodone to relieve pain, it's highly unlikely that you will get addicted to it in psychological sense because you're not taking it to get a high. If you need to take OxyNorm for long periods of time, your body can become tolerant to it, so it may get less effective and you may need higher doses to control pain. With prolonged use, it is possible to become dependent on OxyNorm. However, this is not usually a problem when you stop taking it because withdrawal symptoms can be avoided by reducing treatment gradually. It's important that you don't take a higher dose of OxyNorm than prescribed by your doctor or take it for longer than they recommend. When stopping treatment, always follow your doctor's instructions. So can you drink alcohol with OxyNorm? So you should not drink alcohol while taking OxyNorm, as this may make more likely to feel sleepy, dizzy, confused, and get other side effects such as blurred vision. It may also increase the risk of serious side effects such as shallow breathing, with a risk of stopping breathing and the loss of consciousness. So what about other food and drinks with OxyNorm? Avoid drinking grapefruit juice with or while taking OxyNorm because this can reduce the metabolism of OxyNorm and increase the risk of getting side effects. So can you drive while taking OxyNorm? It may be an offence to drive while you are taking OxyNorm. Do not drive if you think it affects your ability to drive safely. For example, if it makes you feel sleepy, dizzy, unable to concentrate or make decisions, or if you have blurred or double vision. So if you're driving dangerously while taking OxyNorm, you will be breaking the law. If you feel you are safe to drive while taking OxyNorm, it's sensible to carry your prescription with you in case you are asked to take a test by a police officer. As if the test proves positive, there is a medical defence if you are taking OxyNorm as prescribed, as long as your driving is not impaired. For a complete list of the side effects, you can go to or read below or go to my website, lynchespharmacy.com. So that brings this video to an end. If you have any questions, leave them in the comments below or contact me via lynchespharmacy.com. Thank you for watching. Stay healthy and stay informed.